Welcome to LECOM Health Matters. Our guest today is our good friend, Dr. Susan Calderbank. Dr. Susan, welcome to LECOM Health Matters.
Well, thank you. I'm very glad to be here.
Oh, it's a joy to have you with us. Thank you for taking your time from what I know is a very busy schedule of teaching and research, and we appreciate your time. Oral health is an important thing. I read somewhere that 40% of the people in the United States feel pain in their mouth at least once a year, and that 80% of the people have at least one cavity. Don't know if the numbers are true, but how important is it for this audience to know about oral health, and how important is it for them to keep up their oral health?
Well, I have to say that one of the phrases that dentists are always familiar with using is that you can't be in good health unless you have good oral health. It has an influence on all types of diseases like diabetes. If you have inflammation in your mouth, that raises your body's inflammation level, makes it much more difficult to maintain adequate blood sugar levels, and it actually can hasten losing your teeth because the gums become so inflamed. When women are pregnant, if they don't floss their teeth, they can have lower birth weight babies, because as the gums get very irritated, even sometimes by pregnancy hormones, the gums will bleed easily, even if it's microscopic bleeding while they're eating. And then the body's energy is going to fight these far-flung infections because the bacteria get into the bloodstream.
Why do you think oral health is not high on everybody's totem pole as it should be?
I think because in this country, especially, the emphasis has always been on medicine, and dentistry has always been relegated to just this small area of the body, the mouth. And it takes a very wise medical practitioner to realize that oral health has a great deal to do with medical health. And go ahead.
I'm sorry. No, I think people miss that connection. If you could elaborate a bit between oral health and physical health. I think they see them as two separate buckets, and they're really, as you said, they're not.
Correct, because the mouth is part of the body. I have even had physicians ask me, did I expect them to put their hands in someone's mouth? And it's like, yes, I do. So, and they even changed the dental degree a long time ago. Instead of a DDS, which was a doctor of dental surgery, they've now made it DMD, a doctor of medical dentistry, because there is such a huge connection between the mouth and the rest of the body's health.
So there is that connection. Just before we talk a little bit about dental clinics, which is really our focus today, for the general person listening this or watching this, what are some of the simple things people can do to maintain proper oral health?
Well, one thing they need to do is to brush their teeth at least twice a day. Science, we try to do evidence-based dentistry, and the scientific studies show that using a mechanical toothbrush, a battery brush, will take at least 80% more of the plaque off of the teeth. Getting the teeth cleaned and checked twice a year. But one of the most important things they can do is dental flossing.
Oh, God, I knew you were going to say that.
I'm a dentist. Of course I would say that.
I knew you were going to say dental flossing.
You know what? If we break it down as a math equation, your tooth has 5 sides. So when you brush, you can only reach 3 of those 5 sides. So if you were perfect, which none of us are, when you brush your teeth and you don't floss, you're only doing 60% of the work. Now, which is an F grade. Now, because we're not perfect, when we brush, we're only doing about 47% of the ability you have to keep your teeth clean. So flossing gets the parts the brush doesn't reach, and no, water picks don't work, and these new flossing toothbrushes don't work. You have to put the time and effort in and clean out in between the teeth, because that's where the inflammation in the mouth will begin, because as the bacteria clumps together, they eat any sugar that you eat. And then the end product is an acid. And it's sometimes stronger than battery acid. So that's what's living in between your teeth. So you got to floss every day.
I knew you were going to say floss.
Yep.
I think
It's my job.
And you do it well. And I think for people, the brushing is easy, the mouthwash stuff is easy. It's the flossing that really, but when you make a good point when you say it's as strong as battery acid.
And it's in there. And so the gum tissue gets inflamed and it goes, whoa, I don't want to be around this. So it starts moving with the bone away from the teeth. And that's why a lot of people lose their teeth due to gum or periodontal disease. So it's crucial that you floss every day.
Oh, I learned that lesson the hard way about 20 years ago. I had some periodontal work done in the back because, as you said, I wasn't flossing.
And another thing that is very, very important, and people really don't realize this, that as we age, our teeth can become more brittle. And so things like ice, nuts, and popcorn really should be avoided as you age, because your teeth will crack and break. And then you need maybe a root canal, definitely a crown. So even monitoring our diet as we age and not eating all soft foods, that would be really bad for you, but not eating the real hard things. Like I tell people, they can eat almonds, but they have to be slivered, ground up, or drink almond milk.
Well, that's good advice because all of us aren't getting any younger. And you're right.
They should take all those bad things, especially sucking on hard candy, put it in a bag and give it to someone you don't like. Let them ruin their teeth, but I want my patients.
You want your teeth to be just fine. Well, speaking about patients, we've talked about oral health and the importance of keeping up our oral health. We run a dental clinic. You run a couple dental clinics. I think there's a misnomer about dental clinics and what happens in the dental clinic as opposed to a dentist office. So if I'm a patient and I'm driving by LECOM and I see dental clinic, can I go?
Oh my goodness, yes. We welcome everybody into our dental clinic. And I know that clinic, the word clinic sometimes can have a bad connotation, but coming to a clinic such as our clinic at the dental school, it's a fabulous place to come. What people don't realize, they think, oh, I don't want to be worked on by a student or, clinic. Oh, that doesn't even sound nice. But it is wonderful because as the patient comes in and gets assessed, that would be the first step to come in and
stop you for 1 second. When I walk in the door, what am I going to see?
You're going to see, first of all, you're going to see a top-notch dental school all the way to the top with top technology. You will be greeted by PCCs, patient care coordinators. They will take your demographic information. They will take any insurance information that you might have to give them. And then you're seen for a new patient screening. And what that does is it gives us the opportunity to see if your needs would be met by coming into our dental offices.
So the first step then is almost like a patient history of my teeth, if you will.
Correct.
And my gums and my mouth. Somebody's going to come in and they're going to, I'll register, I'll go, and then they'll take that history. And then if it's something you can treat, how does the process work in the clinic then as compared to my own dentist office?
Well, the students have what's called preceptors or dental professionals that will guide the students, approve treatment plans. And the really cool thing about coming to the dental school, if it is a challenging case, as opposed to something very straightforward, many minds come together and decide what is the best course of action for this particular patient. So what you're getting is really customized care. Gentle, customized care.
Can you give us an example of the difference between, say, if I was just going to get a filling done and I had to do something more advanced? Can you give us an example of what that advanced care might be like?
Well, if patients have significant periodontal problems, we address those. That always is first, because we have to lay a good foundation for any care that we may give the patient. Then, for instance, do they have ill-fitting dental appliances, old dentures or partials that may have to be remade? Do teeth have to be reinforced by having crowns put on to hold these partials? We even have the ability here to do dental implants, which is, if you read anything about dentistry today, it's always about dental implants. But LECOM has taken that step forward. So now we're offering dental implants to replace missing teeth. But it's always a stepwise progression, and a treatment plan is made. And when we talk about bringing minds together, there has to be at least 2 signatures of 2 of the dental preceptors, who are our dentists that come in and monitor the student activities, guide them. There need to be 2 signatures on that treatment plan that both dental professionals have looked at that. And then when those are signed off on, we're ready to proceed and take care of the dental needs of the patient.
So the student, regardless of the case, if it's a filling or something like an implant, which is far more complicated, those students are really not completely on their own. They're being watched over by their mentors as they go through their particular steps. And I think the mentors sign off on each step, or at least check each step of the process.
Yes, that is exactly what happens. Even something as simple as a filling, we would have they get a start check, they get permission to get the anesthesia for the patient. Then they will prepare the tooth. The preceptor will speak with them ahead of time. You may want to use this piece of equipment. You may want to go in this direction. That's all carefully mapped out before the patient has anything done. Then the student would cut the preparation, and then the preceptor would approve that. Then they would fill the tooth, and then the preceptor checks that and signs off on the procedure, and then gives the student a grade on that procedure.
So really what you're getting is at least 2 minds on a simple case like a filling. It's not just the dentist in the office, it's the young student and the preceptor watching that student every step along the way.
Yes.
And I expect when we get to complicated things like implants, it's even more comprehensive.
Yes, we have not just general dentists here, but we do have a full cadre of specialists that come in. We have pediatric specialists, we have oral surgeons, we have root canal specialists. We try and cover all of our bases when even giving simple dental care.
And we can't make the point enough that this is open to anybody that walks in the door.
Yes, exactly. It is totally open and available. And one of the nicest things that I found coming to LECOM is that LECOM truly believes in their mission statement to serve the underserved. And we do have the ability in special cases to discount our procedures so that the general public is able to actually be able to afford these. And the word out on the street, because I am, in addition to being the director of the clinic, I'm one of the dental examiners that goes out to give the students their examinations. And the word on the street is that if you're going to hire a new grad to come and work in your office, you want to hire a LECOM grad, because they get more clinical experience than the graduates coming out of most dental schools in the country right now.
So our graduates who graduate from your clinic really are well prepared to go and step in as sole practitioners or join joint practices when they've seen the whole spectrum. I have to talk about this, and I hate to, and I know it's an unfair question even to ask, but in terms of cost, is it a little bit cheaper than a regular dentist office, or does it depend on the needs and the circumstances of the individual's precinct?
It is less expensive. I would always use the term less expensive rather than cheap, because I think cheap
Connotation is better with less expensive. You're right.
Right. And the cheap seems like they're getting second-rate care when actually they're getting top-rate care. And again, it's because of all the good preceptors that we hire and the ability to discount the procedures is such a gift for these patients. We give veterans a straight 20% discount for their service and thanks for their military service. It's just a very rewarding place to work. When you leave at the end of the day, you know you've done some good in the world.
I know you have done a lot of good in the world. That I know for a fact. And I also know that we'll take care of you one way or another if we absolutely have to. We'll figure something out, because oral health, as we said earlier on, is important. But I hope it's important for our audience to understand this is less expensive first-rate care, if I can put it that way. You're going to pay a little less than a dentist office, and you're going to go to a clinic, probably take a little bit longer than it might in a regular dentist office.
It does.
But that's all right, because you're getting consultation, you're getting somebody watching over the students in simple cases and in complicated cases, and you're getting really quality care. It just may take a little bit longer than a normal dentist office.
Yep. And we do reach out even when there are special situations. For instance, yesterday we had a 9-year-old come in who fell down the steps at school, totally lost his front tooth. They had to come with the grandmother, and we had the ability to bring that child right into our clinic. We put that tooth back in the child's mouth, stabilized it, and he walked out of here better than when he walked in. And that is always our goal, that the patients leave better than when they walked in the door.
And that's a real blessing for the little one too, because I would suspect in this day and age, I don't know, but my guess is that children and parents, we don't pay enough attention to our kids' teeth these days.
Exactly.
Pediatric dentistry, I think, is really something that people have to think twice about, because I think they think dentist office insurance is expensive. And so sometimes it gets pushed on the back burner when really we have to start them out right. And we do that as well. Pediatrics to seniors, we do the whole spectrum.
We do a large majority of the pediatric patients in this area. And what the general public does not know is that teeth are the hardest part of your body. They're much harder than your bones. And we have the ability, through the use of dental sealants and better dental care, to raise these children so that they never in their life have a cavity. And that is such a blessing.
That's a blessing. One final question, because we're running out of time. How do I find you? What do I do if I mean, I know we said I can drive into the parking lot and walk right in, but there's probably going to be a patient backlog. What do I do if I've heard this or seen this interview and say, I want to give that a shot? I want to try that. How do I do that?
You would call 814-868-1001. You will immediately be connected to a PCP who will assess your needs, take your information, and give you an appointment. We're at 2000 West Grandview Boulevard in Erie, and we would welcome all of you to come.
Well, our guest today has been Dr. Susan Calderbank, our good friend. She directs our clinic that really provides many blessings to people in Erie and our clinics in Florida. So, Susan, thank you very much for your time. Thank you for your talent, and thank you for what you do for the oral health needs of the communities that we serve. This is Monsignor.
Thank you for having me today. It was a pleasure.
It has been my pleasure. This is Father Rubino for LECOM Health Matters.